Coronavirus 2019 or COVID-19 is an infectious disease caused by SARS-CoV-2 virus. COVID-19 has been labeled as a public health emergency of international concern by World Health Organization. Though much is yet to be learned about the mode of transmission, it's now believed that the primary mode of transmission is by either direct transmission, which is through airborne droplets generated from a sick patient during coughing and sneezing, or by indirect transmission, which is through contact with contaminated surfaces and subsequent contact with individuals' mouth, nose, or eyes. Considering the fact that dentists are regarded as a high-risk group, it's essential that dentists are aware of the latest guidelines on how to manage the risk of COVID-19 transmission. Thank you.
A common question that we've all been asking ourselves in the last 2 months is it safe to start clinical practice? Well, the answer is yes, provided we follow the recommendations of the Ministry of Health. One of the recommendations put forth by the Ministry of Health is that we limit our practice to performing only emergency dental services and we postpone all elective dental procedures. In a dental clinic, our primary focus should be on procedures that relieves pain or prevents infection. The following are some of the common situations that we might come across. A patient reporting with severe pain from pulpal inflammation. This is probably the most common reason for patients to seek a dental appointment. Pulpotomy or pulpectomy are the recommended treatment options. Incision and drainage should be performed if there is any periapical abscesses. Extensive dental caries should be managed, preferably using interim therapeutic restorations. Severely infected teeth should be extracted, and dental traumas should also be managed appropriately. This is not an all-inclusive list. A dentist should use their professional judgment in determining a patient's need.
The following routine and non-urgent dental procedures must be postponed or deferred until further notice. Initial or periodic oral examinations and recall visits, including routine radiographs. Also, routine dental cleaning and preventive therapies. Orthodontic procedures other than those to address acute issues, pain, infection, and trauma. Extraction of asymptomatic teeth, and all restorative dentistry, including treatment of asymptomatic caries lesions. All aesthetic dental procedures.
Let us now turn our focus on how to minimize the risk factors in a clinic before the treatment. First of all, the dentist should ensure the safety of all the staff. Training and retraining the staff is very important on correct infection control. Since every patient is a potential carrier, the screening should start with telephonic conversation with the patient, and non-urgent treatment should be pushed for later. Trash should be done at the entrance of the clinic. Signs and visual alerts to be placed in public areas for patient awareness. Alcohol-based rub should be available at the entrance. The existing seating arrangements should be modified to accommodate the social distancing, and overlapping of appointments should be avoided. And finally, the instructions to the patient before the arrival to the clinic. It's better to ask the patient to wait in the car and call up the reception. And once the clinic is free, the reception can call the patient to come up after finishing the triage. And once inside, they have to follow the social distancing and also the infection control etiquettes. Thank you.
The million-dollar question is, are we safe in the clinic?
To ensure this, we can follow some of the recommendations put forth by the International Health Organization. This starts right away from the dental clinic, where it should be well ventilated with a minimum of 6 air changes per hour,
or an inbuilt HEPA filters. Apart from dental operatory patient assessment and treatment protocol during COVID-19 by the Ministry of Health, we can also go through these recommendations.
Next comes personal protection, like adhering to standard contact and airborne precautions, hand hygiene, personal hygiene, and personal protective equipment.
we need to wear protective equipments while working in dental clinic. PPE includes
Protective attire, mask and respirators, gloves, goggle, facial, other accessories like head caps and shoe covers as you prefer. Steps for donning personal protective equipment.
Wearing a medical mask is one of the preventive measures which limit the spread of respiratory diseases like COVID-19.
CDC recommends a NIOSH approved ASTM-3 particulate respirator equal to or greater than N95.
How to put on a respirator?
Hold the respirator under your chin with the nose piece up. Take the bottom strap and extend it up over your head. Rest it at the bottom of your neck below your ears and take the top strap and pull it over your head and rest it on the back of your head above your ears. Place your fingertips from both hands at the top of the metal nose clips and slide your fingertips across and down, molding it to your nose. Place both hands over the respirator and take a quick breath in to check whether the respirator has a good seal. Breathe out and check for any air leakage. If you feel the air escaping, there is not a proper seal, then readjust the straps, nose piece or position around the chin until a proper seal has been achieved.
Removing the respirator.
Do not touch the front of the mask when removing it. It may be contaminated. To remove, pull the bottom strap over the back of the head, followed by the top strap. Discard the mask into the appropriate waste container and proceed to wash your hands and arms with soap and water.
Steps for doffing personal protective equipment.
There is so much more to be known about this new disease. There are no drugs to treat this disease as of today. However, prevention is better than cure. So follow SMS, that is social distancing, mask wearing and soaps and hand wash. As healthcare professionals, it is important that we keep ourselves updated with the latest information and guidelines. There are several online resources which provide reliable information like the World Health Organization (WHO), Center for Disease Control (CDC), and American Dental Association (ADA). Like many previous pandemics, we will overcome this one also. Until then, let's focus on breaking the chain. Stay safe.